There are many forms of birth control. The option is really up to you. It is based on your personal and your family history. So your provider will ask you if you have migraine headache with an aura or any personal history of blood clots in your lungs or your legs. If you answer yes to those, you would not be a candidate for an estrogen-containing form of contraception. In addition, if your family has a history of pulmonary embolism or clots in the lungs, or DVT, clots in the legs, or sudden cardiac death under the age of 40, we would encourage no estrogen-containing form of contraception for you.
And so there's a lot of options out there. We can definitely pick something that tailors to what it is you need and what it is you're looking for in a birth control. There's pills that you can take every day. There's a patch you can change and wear weekly. There's a ring that you can insert for somewhere between 21 and 28 days at a time, depending on what your preference is. And then there are implants, and different implants. There's a bar that goes in the arm and different IUDs that can be inserted, along with a shot that can be given every 90 days. So there's a lot of options that we have for you.
The combination birth control pill contains estrogen and progesterone. That pill should be taken each day at a pretty close to the same time. However, if you are a little bit later taking that pill, it still continues to provide you ovulation suppression, so you got a little bit of wiggle room there. If you choose the progesterone only pill, that pill needs to be taken at about the same time every day. Swaying 2 hours either way of your pill time could result in ovulation and an undesired pregnancy.
And why that is because, like Shelley mentioned, with a combination pill and preventing ovulation, that means it prevents that release of the egg. So there's no egg there to fertilize. And with the progesterone-only pill, it's a little bit different. How that one works is it causes the mucus at the cervix to kind of put up a blockade so the sperm can't get through. And we found that if you're even off by a few hours on that pill, then some of those blockades come down and the sperm can get through. So you got to be super smart about timing those sort of options. And that's why they came up with other things, such as wearing a patch. And the patch we don't want you wearing on your chest, but you can wear it along the back side of your back, or you can wear it anywhere through the belt region. And typically the patch stays on for a week at a time. You change it out for 3 weeks in a row and then go a patch-free week to have a period.
When using the patch form of contraception, you have to be patch-free for 1 week because your risk of developing a blood clot increases with continuous use of the patch.
And then there's a Nuva ring, and that can be inserted into the vagina, much like a tampon is inserted. But one sits there for 28 days, and another sits there for 21 days. And then one's changed out to get a brand new one each time, and the other one, you keep it at the side, and then you put it back in after the week of your menstrual flow. And so it works quite well, just depending on what you want to do, but realize you do have to reach in the vagina and remove it.
Yes. That ring can stay in place when you are sexually active. Yourself and your partner should not be bothered by that ring being in place. Another form of progesterone-only contraception is the Nexplanon. It's about a 4-centimeter implant. It goes into the inner aspect of your non-dominant arm. So if you don't tell anyone it's there, they won't know that it's there. The healthcare provider will wash that part of your arm with some betadine to clear away the normal skin organisms so we have a clean environment. You'll have a bit of numbing medication or lidocaine injected. You may or may not feel the poke, but the medicine causes a little bit of a bite, like a bee bite. And then there's an insertion device that will place that exactly where it needs to be. If you love this form of contraception, you can use that for 3 years. It can be removed and replace a new implant in the same site.
And most women who have the Nexplanon in place after a few months don't have any menstruation at all. So that's kind of a nice thing if you want to get away from your periods.
Yes.
Yeah. The next option are all of the IUDs, and there's several options there for IUDs. There are different lengths of time that they're placed, from 3 years to 10 years, depending on what you're looking for. And as Shelley mentioned about how the arm bar has a bit of a bite, The IUD has a bit of a bite as well.
So your healthcare provider will place the speculum, again, cleanse your cervix of normal vaginal organisms, and then they do a measurement from the cervix to the top of the uterus. The length of that determines which IUD would be best for you.
And then the IUD is inserted, so we go into the vagina and put the IUD up into the uterus, and then it's implanted there. As you can see, the white structure inside of that uterus would be the IUD. And this is an example of one. So this would be squished down, come up into the cervix, then it would open up. And then these strings, we would trim these in the vagina, so they would sit inside the vagina to be held. And then when it's time to remove it, we put a speculum back in, grab those strings, and remove it. So the strings are up inside your body. They're not out by the labia.
After the IUD is placed within the next 24 hours or so, your body will warm up those strings and they'll migrate and usually float up here. So when you are sexually active, those strings will not bother your partner nor yourself.
The next option is the Depo-Provera shot, and that's given every 90 days. And we can teach you how to give it to yourself even. If you're competent with needles, we can teach you even if you're not. One of the issues, though, and why some people shy away from the Depo-Provera is there is about a 10-pound associated weight gain after you've taken 3 of the shots.
Depo-Provera is also the only form of contraception that we cannot take away from the last injection that will remain in your system. So when planning to become pregnant, you have to be a little creative with that. That last injection really could stay in your system and change your menstrual cycle for a year or even more, closer to 18 months.
It's true. And as Shelley mentioned earlier, there's some health conditions where you want to avoid estrogen, but Depo-Provera doesn't have any estrogen, so it's a really good option for that situation. So we have a lot of options out there for you. Please seek help for something that fits you and your lifestyle.
And please remember, all of the forms of contraception that we have just mentioned will not prevent the transmission of sexually transmitted infections, so condoms will need to be used along with any of these forms to prevent that.
And that's really important just for your overall health.